Hey everybody, this is Jason Odegaard with OKC Kids Urology coming at you today to make another video regarding clean intermittent catheterization. And a bladder exstrophy, one of the big surgeries can be a bladder augmentation, possibly bladder ligation or narrowing of the bladder neck. And the third part of that could involve putting a catheterizable stoma in or near your belly button. And I know I've spoken to a lot of you parents or kids who have not had that surgery yet, but you've got a kiddo who's maybe 6, 7, 8, 9 years old, possibly even teenagers. And I've even spoken to you, those of you who are in your 20s who still are just wearing pull-ups every day, comfortable enough with it because you're used to it, but at the same time, you're still considered wet. You're not socially dry. You're wearing a pad, the pull-up, like I said, or some other variation in order to stay dry. And, there's a lot of struggles that come with that. The smells, the fear of leaking, messing up your clothing and other things. So I'm here today to show you, because I know a lot of conversations I've had with those of you that have exstrophy has been one of fear of surgery, the fear of this being a permanent thing, of this is the only way I can pee from now on, or something of that effect. So I'm here with my son Austin to show you it's not a scary thing. It's actually a very simple thing. It makes your life so much easier and so much better. And I know that his quality of life has improved drastically with an augmentation, a ligation, and a catheterizable stoma. So today we're just going to show you the whole process, start to finish. Doesn't take very long. It's just a few minutes. I just say, hey, it's time to cath, and off he is. He comes back, and then he's done in just 2-3 minutes later. So
hi, I'm Austin, and I'm 9 years old.
You're 9 years old, and you've been cathing for about how long now? A little over a year.
Yes.
Austin had surgery about a month before he turned 8 years old.
Yes, that's true.
Currently, you're 9 plus a few months. So we're going to show everybody how to cath. First thing, what's the first thing we do before we cath?
We wash our hands.
We wash our hands. Great. So go ahead and do that. Now the key here is we call this clean intermittent catheterization. It's not sterile. It's not required to be totally sterile, just clean. So washing our hands is totally sufficient way to get clean, just like you would go to the bathroom and wash your hands after. Here we just do it before and after. So before we touch anything that goes in our bladder, we just want to be reasonably clean. So now that our hands are clean, and before we actually cath, let's take a look at your stoma really quick. So if we get in close here, we can see it's just this little hole right out of his belly button. Now it's fleshy, it's soft, I can touch it. You can see it doesn't hurt or anything. The other questions people get is, will I be able to live a normal lifestyle? Austin is very active with mixed martial arts and karate and that sort of thing. He also loves to swim. He loves to ride ATVs, ride bikes, basketball, jump on a trampoline, all kinds of sports and things like that. So don't let the belief that this can limit you in any way get in the way, because it's just not true. And so Austin was fortunate enough at his age to be able to stretch the bladder up to his belly button. Some of the challenges, if you're a bit older, say a preteen or teenager or beyond, if you're really tall, my understanding is that it's harder to get the bladder up actually to the belly button, to use that as the entry point for the stoma. So if that's the case, if you happen to be a little bit older, it might be down here on your belt line. So you'll have your belly button, whatever that is. And then you'll have your stoma right here along your belt line. But either way, which is actually fine, because you can hide it, like I said, swimming or things like that. Most people may notice it's a little different. Some people pay attention to it, others don't. Austin tends to wear a swim shirt just for his own sake, and nobody notices it, so it's totally perfect. So that's what the stoma looks like, and again, we're just going to pass a little catheter into that, and that's how he pees. So what do we do next?
We get a catheter out.
We get a catheter.
So we lay it down and tear it open.
That's right. So hold up that catheter. Let's take a look at it for a minute. And this is what's called a 14 French in terms of the size. They have 10, 12, 14, 16. Each one, the higher the number, the bigger it is. Austin's happens to be a 14, which is great because That really allows for just more fluid to come out more quickly, allows the pee to come out faster, so he's in and out a lot more easily. At the end of the catheter, in case you were wondering, see if I can get the camera to zoom in on it. I'm zooming in on the background. There are a couple of eyelets, some holes that where the urine comes out, and so it's not actually at the very tip. Let me try and get to focus here. It's not actually at the very tip, it's near the end. There we can see one of them, and then there's the other one, kind of blurry. And so that's where the pee comes out. The reason we like the bigger catheters is because when you have an augmentation like Austin does, usually the augmentation is done with intestine. And intestine, by virtue of what it is, it makes mucus. And so the larger the catheter, the faster the mucus can come out along with the pee, and then there's less of a chance for clogs. If you have too much mucus, then it can create stones, unfortunately, but we also do irrigation, which takes about 30 seconds twice a day. Do it first thing in the morning and last thing at night. Goes pretty fast, but that's the only other thing. Other than that, he's got a nice big bladder, thanks to Dr. Kropp, and he has to cath about every 4 hours. Unless he's really playing and drinking a ton of water, then he does it faster. Okay, and so since the stoma is made out of appendix, we want it to be nice and smooth when we pass the catheter through there into his bladder. So we use, over there's some silicone jelly. So go ahead and, some lubricating jelly, go ahead and dip it in there. And we just dip the tip in. Don't have to use a whole lot.
Like this.
Just like that, yep. Maybe the first inch or so. And then he just sticks it right in there.
Nice and slow.
Nice and slow, that's
so
right.
So you don't poke a hole in your stoma.
That's right.
Out it comes.
There is such a thing as, especially teenagers, they get in a hurry and they want to pee fast, and they jam the catheter in super fast. And if they do it too fast, they can kind of poke a hole-ish in their stoma, and it's called a false pass. And that requires a few weeks to a month to heal up. So we always want to be gentle and slow whenever we're putting a catheter in, but usually we don't have any issues with it. So now that we're done cathing, we see he's done peeing. First thing we do is we kink the end of it, kind of like you would kink a straw, because you don't want that fluid that's in here when you pull it out. If you didn't kink it, all the fluid that's in here would go back into his stoma, into the one-way valve, and cause irritation or things like that. So we kink it first, then we pull it out, drain it in there. You can give that to me. And then make sure you wipe your jelly, because sometimes that jelly leaves itself on there. So just a quick wipe and toss it in. Great.
And then we just flush that toilet.
And wash our hands again, right?
Yep.
Go ahead and do that again.
And then we just dry like we did before.
That's right. Very easy, right?
Yep, super simple.
Yep, so again, cathing, very simple. Doesn't have to be perfect and sterile, just clean. We just stick the catheter in, pee comes out, we take it out, and we're all done. Can go 4 hours in between cathing, which is perfect. And that's about it. Thank you for helping me with my video, Austin. Do you have any final thoughts?
Yes, take care of your bladder.
Take care of your bladder, that's right. You only get one, so this is just a very simple way to do it. Again, if you're concerned about cathing, is it too much work? Is it too hard? Is it too much to manage and think about? It's really not. We just showed you how it works. And if you have any questions or comments, hopefully you're viewing this through our Bladder Exstrophy app. And you can go to the forum section and make a post there, and I'll respond to that. Or go to the Contact Us page, shoot me an email through there, and I'd be happy to answer any other questions. All right? So again, this is Jason from OKC Kids Urology. Thanks for watching, and we'll talk to you soon. Say bye.
Before I say bye, it's not that big of a deal.
It's not.
And if you feel bladder pressure before you cath, like you drink a ton of water, that's perfectly normal.
That's right. Very good. All right, we'll talk to you soon.
Bye.